In Australia's two biggest COVID states, the return to school is ramping up. Victorian Year 12 students returned on-site last week. Regional classrooms are back in full swing from tomorrow. In Melbourne, the rest will follow by October 26th, when the state reaches 70% double-dosed.
We're on track to get there, and we may even get there a little bit earlier.
Staff and students in New South Wales were this week surprised, with the reopening brought forward a week. Year 12s and Year 1s will be back on October 18th, the rest behind their desks by the 25th.
That's great for kids. It's a major relief for parents and their sanity.
But there's just one problem.
This really is a pandemic now of the unvaccinated.
And despite vaccination rates for 12 to 15-year-olds racing ahead with around 51.5% receiving their first dose, there's still no plan for younger kids.
Over the past 3 months, we've seen cases in children under 10 grow at 3 times the rate of adults. And yet there's been no effort from federal and state governments to explain why it's safe to reopen without children vaccinated.
But a key concern is ventilation. While Victoria has spent $190 million on 51,000 air purifiers for schools, New South Wales is yet to confirm they've made any orders or completed ventilation tests.
I can tell you that having good airflow, good air exchange is going to reduce the risk of transmission in those settings.
In England, students went back to school in early September, maskless and mostly unvaccinated. And COVID cases jumped from 122,000 to 204,000 within 2 weeks. Hospitalisation rates for kids between 5 to 14 increased by 42% since January, but they remain the lowest of any age group. Back here, Pfizer is set to make its case to the TGA to fast-track its jab for kids aged 5 to 11, eyeing a Christmas deadline. But as kids start making their long-awaited return, are we properly prepared?
Professor Fiona Russell is a paediatric epidemiologist and she joins us now. Professor, we've seen what's happened in the UK when kids went back to school there. Is the reality that Aussie parents are going to have to accept that their kids are going to get COVID and that they're going to bring it back home?
Yes, look, I think that's correct, Lisa. So what we will expect when schools open is that infections certainly will rise, and that's alongside, the broader community restrictions also easing, that there will be an increase in community infections, and what happens in the community by and large spills over into schools as well. And that's why it's so important that teenagers get vaccinated and also their parents as well, and whoever's living in the household with a parent. So really extremely important that vaccination gets taken up.
So if a child that's unvaccinated does get COVID, how serious is it likely to be?
Yeah, so by and large, the infection lasts for about 4 or 5 days, and they'll have about 3 or 4 symptoms. And those symptoms are pretty much like any other cough and cold. They'll have runny nose, a cough, a headache, and feel tired. So they're the commonest symptoms to have. About 2% will present to hospital for treatment. And by 1 month after the initial infection, 99% don't have any symptoms at all.
Professor, Victoria is mandating masks for kids grade 3 and above. 1, how much difference do you think that'll make? And 2, how on earth do you make sure that a 10-year-old complies with that regulation?
It is critical that parents try and encourage their kids to wear a mask. So we would strongly recommend that. But there's a whole suite of measures, such as improving ventilation. Vaccinating teachers is absolutely number one. They're the primary reason of what happens in schools in terms of transmission. So infections from teacher to teacher and from teacher to child, that's really the main source of transmission. Now, when it comes to, getting a 10-year-old to wear a mask, most kids by and large will be absolutely fine and they will adapt, and there's no doubt about that. But of course, we have children who have disabilities and behavioural issues that or even, just defiant kids who just will not do it. And so, but we've been role modelling for our kids for about a year now. So a lot of kids will be able to do it. It's important to just sort of practice, practice at home, practice with going to the park. But really, it's really important not to get too stressed out about it either.
Professor Fiona Russell, we'll have to leave it there. Thanks so much for joining us this evening.
Thank you, Lisa.
Well, the New South Wales Education Department did get back to us very late in the day, and you can check out their statement on our website.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.